Hello, I'm Martin Woodrow. I'm the Chief Executive of the British Dental Association, and I'm going to run through the key COVID-19 related issues for the sector this week. The first issue I want to talk about is urgent care centres. Well, we've seen quite a lot of progress in the devolved nations across the last week or so as far as urgent care is concerned. All three countries making progress in setting up their own care systems. Colette Bridgman, the CDO in Wales, reported that in the last month the care system in Wales had seen around 1,400 patients and handled around 23,000 calls. Unfortunately, progress in England has been less rapid. Mick Armstrong, BDA Chair, and myself have had regular meetings with Health Minister Joe Churchill to discuss the situation in England. As of yesterday, we were told that there are around 160 sites running in England, with further centres planned across the coming days. However, we are still concerned about a number of reports coming locally about delays in the process of setting these up across England, and we'll continue to pursue that with Minister. And that brings me on to the second issue I wanted to talk about, which is personal protective equipment. We had the much anticipated revised standard operating procedure for England published this week, along with a fourth letter of preparedness. The SOP didn't really fundamentally change the position as far as PPE is concerned, and we've still got a position that's consistent across the four nations on PPE and its use when we are using non-aerosol generating procedures, and we know that concerns some of you, and we're continuing to reflect those concerns. We are particularly interested in the supply of PPE this week. We're running a survey on it. We're particularly asking those of you who are working in urgent care systems if you're getting the PPE that you need. So please look out for that on our website. We would really value you filling it in to give us the information that we can use for discussions with relevant bodies across the UK. Third area I wanted to talk about was financial support for dentists. We've continued to lobby strongly on this issue, particularly for private practices this week. We saw coverage over the weekend in the media on the impact of the pandemic on private practice in the Sunday Times, the Mail on Sunday, as well as broadcast coverage, and there should be more coming, so look out for that. Many of you have helped us with lobbying of MPs, thank you for that, and in the devolved nations we're asking parliamentarians to act immediately to support private practice and put in place financial remedies as they can. Separately, we've also launched a pay dispute resolution service for associates. As you know, in England and Wales, corporate bodies and practice owners with NHS contracts continue to get paid assuming certain conditions are met. And one of those is that they pass on income to associates. We're sure that most practice owners, most corporates are going to do that without any difficulties, but if there are problems and you're an associate, please check out our resolution service and get in touch with us. Fourth area I wanted to mention this week was education and training. We've requested clarity on plans for completion of dental foundation training and equivalent across the four nations from postgraduate deans. We've asked for formal confirmation that payments to training practices in England in respect of DFT will continue without change. NHS employers this week have confirmed that they support our request to suspend mandatory training and appraisal in England for community dentists, and appraisal will be suspended until September 2020. Just a couple of final thoughts. Firstly, we're going to be holding a webinar on Wednesday the 29th of April at 2 p.m. and we'll be answering your questions on the financial packages available and how they work, around furloughing staff and how to retain staff, around paying associates in NHS and mixed practices. What you'll need to do is send questions in ahead of time, so check the website please for more details. And finally, the BDA operates an honours and award system. We know that many dentists are going above and beyond for their colleagues, for their patients, communities at this difficult time. So we've extended our honours and awards deadline to ensure that this good work can be properly recognised. So please get your nominations in under that system to us by the 31st of July. So on that note, I wish you a safe and happy weekend, and I will speak to you again next week.